question about gluten-free and gluten sensitivity has been around for a long time, but it has certainly become a more pressing question that has come up among our patients and among people around the country more in recent years. The answer is that yes, gluten sensitivity does seem to be on the rise. Experts disagree as to whether this stems from greater testing and greater recognition of the problem, or whether there is truly an increase in the sensitivity that we have to gluten. Gluten sensitivity stems from an autoimmune response, meaning that our bodies have an immunological reaction to gluten. About 1% of us in the population have this condition, and it goes by the name celiac sprue. Celiac sprue can be diagnosed with blood tests that tests for the antibody. It can also be diagnosed by an endoscopy, in which a lighted endoscope is passed down into the small intestine and direct biopsies are taken. For some people, the problem or the disease, if you will, is a severe one where people have a lot of symptoms, a lot of gastrointestinal upset, pains, cramps, diarrhea, and symptoms like that. And for other people, it is milder. There also may be people who are less severely affected by gluten. And this is an area where there's greater controversy, where perhaps more people are sensitive to the gluten, but they don't have the full-blown disease of celiac sprue. What we've found is that enough of our patients have told us that they are sensitive to gluten that we decided to remove gluten from our own products and make sure that everybody could tolerate anything that we had to offer, no matter how gluten sensitive they were. Gluten is most commonly found in wheat products, but it's also in other grains, including barley and rye. So one has to read the label very carefully to find something that is gluten-free. But with removal of gluten from the diet, people can see a real reduction in the symptoms they're having, and they can see that they're able to tolerate a wider variety of foods in their diet. So if you think you're having these kinds of symptoms with abdominal pains, cramping, diarrhea, it's one of the avenues to look to. Usually it requires visiting with a gastroenterologist who can help make the diagnosis. So that's usually the place to start.